There is a combination of factors that have led to his respiratory symptoms. Patrick is currently diagnosed with chronic obstructive pulmonary disease, COPD. Patrick was a smoker from the ages of 20 to approximately 60 years. Smoking is one of the leading causes of COPD. During the course of his years of smoking, irreversible damage, dysphagia, occurred to his cilia in his bronchioles, causing them to mutate. The mutated cilia are then unable to rid the body of the buildup of mucus in the lungs. This can be seen in Patrick's respiratory symptoms. His constant coughing is trying to rid the body of mucus sitting on the lungs, and he is now struggling to get this out. Another cause of his respiratory symptoms are also a result of his COPD. Patrick has swelling of his legs, also known as edema. This could indicate that he also has pulmonary edema or swelling on the lungs, or an increase of fluid on the lungs, which has led to a difficulty of breathing. As discussed earlier, Patrick has COPD. This disease decreases the lungs' ability to facilitate effective oxygen exchange and decreasing the amount of oxygen in the blood. This causes the heart rate to increase to try and pump more blood and oxygen around the body. COPD is a disease that progressively worsens by irreversible obstruction to the airways. It is a preventable and treatable disease that can be characterized by emphysema, chronic bronchitis, and bronchiolitis. In Patrick's case, we will only focus on the factors of emphysema. Emphysema is a condition involving damage to the alveoli. Over time, the walls of the air sacs become frail and eventually rupture, in turn creating larger air spaces, reducing the surface area of the lungs. This leads to a decrease in oxygen reaching the bloodstream. When damage has occurred to the alveoli, such as in Patrick's case, then air becomes trapped, resulting in a decreased amount of room for oxygen to enter. Elastin fibers are found in the walls of the alveoli, surrounding the bronchi and capillaries, allowing lungs to relax and stretch, or expand. In simple terms, allows the chest to decrease in volume, causing carbon dioxide to be exhaled and removed from the body. Whereas left side heart failure is a direct result of left ventricular dysfunction through the prevention of forward blood flow continuing onto the atrium and pulmonary veins. This leads to an increased pulmonary pressure, causing fluid to leak into the interstitial fluids and onto the alveoli. Pulmonary congestion and edema are thereafter a result. Having a weakened heart will alter the cardiac output. Cardiac output is produced by two variables, heart rate and stroke volume. Stroke volume consists of preload, afterload, and contractility. Preload refers to the initial stretching of the cardiac myocytes before contraction. Afterload is the amount of force against the myocardium to contract to eject the blood, and contractility is the intrinsic strength of the myocardium independent to preload. This can change in preload through the force of the contraction. Patrick's left side heart failure has occurred due to an interruption of this process. Cardiac output is determined by the heart rate and stroke volume. Stroke volume consists of three factors: the preload, afterload, and contractility. These conditions have developed separately and are exacerbated by each other. COPD causes a decrease in oxygen levels in the blood, thus placing further stress on the heart, making Patrick's left side heart failure more severe. Furthermore, left side heart failure contributes to a build-up in the lungs and aggravates the COPD. Due to the fact Patrick has left side heart failure, meaning the forward effect of blood going to the aorta is decreased. This decreases blood pressure and in turn decreases the amount of volume. Due to the decrease in stroke volume, the renin-angiotensin-aldosterone system kicks into gear to enforce vascular constriction to the vessels in the heart and in turn increase Patrick's blood pressure. The prevention of the forward flow is also caused due to a backup or congestion in the left atrium and pulmonary veins. With an increased pulmonary volume, it causes leakage into the interstitium and eventually into the alveoli, resulting in edema and pulmonary congestion. Following on from left side heart failure, it is well known that if the left side of the heart is failing, then the right is more likely to fail with time. This is due to the left-sided pulmonary congestion already occurring with Patrick and increased pressure in the blood vessels of the lungs. Normally, the right ventricle and pulmonary circulatory systems are low in pressure in comparison to the left. Eventually, Patrick will be looking at chronic pulmonary hypertension, which is also known as an increased afterload, resulting in hypertrophy and heart failure to the right side of the myocardium. Patrick's COPD will be causing constriction of the pulmonary vessels in response to the hypoxia, where further respiratory acidosis and further constriction of the vessels will occur. After having a blood test, we can look at Patrick's results and interpret them. His sodium levels at 150 millimoles per litre are high. His potassium at 5.2 millimoles a litre are high. His calcium at 2.05 millimoles a litre are low. His hemoglobin at 111 grams per litre are low. His LDL, or his bad cholesterol, is high at 3.5 millimoles a litre. His HDL, or good cholesterol, at 0.8 millimoles is significantly low. His triglycerides at 4.2 millimole a litre are high, and his glucose levels at 8.5 are well high. Patrick's blood test results indicate that currently he has an increased risk of both complete heart failure and stroke. Patrick's LDL and triglycerides are high, and in conjunction with low levels of HDL, this could lead to a blockage in the arteries due to a buildup of plaque. HDL moves excess lipids from around the organs and arteries into the liver to be secreted. When HDL levels are low, lipid storage occurs within the arteries, known as a plaque buildup, and around primary organs. When plaque builds up to becomes too great, it has the potential to cause a blockage of blood flow in the arteries and leading to the brain. When this occurs, there is a lack of oxygen being supplied to the brain, causing a thrombotic stroke. A stroke can cause significant long-term impairment to the brain, area of the brain that is affected. For example, the area of the brain that controls movement can be impaired to such an extent that the patient will lose ability to control their own movement. Also from the results, we can see that his hemoglobin levels are low. This is a result of Patrick's COPD causing a decrease in lung function. When there is a drop in oxygen levels in the blood, there is also a drop in hemoglobin. Patrick's glucose levels can be seen to be above normal ranges. He has currently low hemoglobin. Hemoglobin is a protein within the blood that enables oxygen to be carried around. When there are high levels of glucose in the blood, these glucose molecules will attach to the hemoglobin. This means that there is less room for oxygen to circulate throughout the body. Oxygen is needed throughout the body to help activate ATP within the cells so that energy can be released. Therefore, when there is a lack of oxygen circulation throughout the body, there is a decrease in the body's cells being able to function. Glucose at such high levels can also indicate that Patrick has become pre-diabetic, and diabetics and such high levels could mean that he is having a hyperglycemic attack. Patrick's low levels of calcium indicate that he could have hypocalcemia. Hypocalcemia can cause neurological function and seizures and is prominent with geriatric patients. The calcium levels in the blood are undergoing hypoosmolarity. This is when there is a high concentration inside the cell. Other ions which aren't in their proper place and that could also lead to neurological dysfunction is Patrick's increased levels of potassium, which is indicated in hyperkalemia. This shows that Patrick currently has an imbalance in electrolyte levels. This can be clinically seen through the swelling of his legs, as well as any other neurological dysfunction. The potassium in his body cells is migrating from inside the cell to the extracellular fluid. This is known as osmosis, when a compound will move from a high concentrations to a low through a membrane. Hyperlipemia can cause irritability and anxiety in a patient and is usually a result of impaired renal excretion. The buildup of these ions can cause swelling in the brain and lead to neurological. An additional blood test for Patrick, in which would be abnormal, would be a B-type neurotic peptide (BNP) test. BNP is a hormone secreted by the cardiomyocytes in the myocardium ventricles and can differentiate between a cardiac or respiratory cause of dyspnea. BNP is released when there is an increase in arterial pressure, such as in Patrick's case, and an increase in blood volume from his left side heart failure, as well as elevated serum sodium levels. The PNT hormone acts as an agonist to the renin-angiotensin-aldosterone system and is produced in response to an increased arterial pressure, for example, increased volume and elevated serum sodium levels. BNP overpowers the secretion of aldosterone, renin, and ADH, and the action of angiotensin II, where in the renal tubules peptides excrete sodium and water, resulting in a decreased in blood volume and pressure. BNP can help diagnose heart failure and the cause of coron pulmonary secondary through to the stretch receptor of the right ventricle. In coron pulmonary, when hypertrophy has occurred in the right ventricle, the likely cause of heart failure is due to lung disease. Thus, overall, Patrick's BNT hormone levels will be increased due to his heart failure and the myocardial infarction to his left coronary artery.